Bladder overactivity. A sudden urge to urinate is caused by a problem with urine collecting in the urinary bladder. It may be difficult to control the urge to urinate, resulting in unintentional urine leaking. Overactive bladder causes embarrassment and discomfort, which can lead to avoidance of social events or employment. Fortunately, once the cause of the problem is identified, overactive bladder can often be treated and the severity of the problem reduced dramatically. Symptoms of overactive bladder: strong and abrupt desire to empty the bladder, as well as urine leakage that occurs suddenly and involuntarily after feeling the need to urinate. Urinating more than 8 times each day voluntarily. Urinating more than thrice in the middle of the night. Even if the patient can go to the bathroom with the desire to urinate every time without urine leakage, the need to stop what they are doing and go to the bathroom without being able to resist causes anxiety and lowers quality of life. Overactive bladder causes and risk factors. Because the bladder is a muscular organ that collects urine inside and excretes it through the urethra, the kidneys create urine fluid that is delivered to the bladder via the ureters. When the bladder bag fills up to 1/3 of its capacity, the neural system alerts the brain that it is time to empty it. It results in emptying, urinary excretion. The involuntary contraction of the bladder causes overactive bladder, which results in a sudden and urgent urge to empty. In certain circumstances, the impulse is triggered by a mistaken sense of the bladder contracting without really contracting. There are a few things to rule out before commencing treatment for an overactive bladder. Parkinson's disease, multiple sclerosis, and stroke are examples of neurological illnesses. Large amounts of urine are produced as a result of excessive drinking, diabetes, and numerous renal illnesses. A bladder tumor or the presence of stones might cause structural damage to the bladder bag. Obstruction at the bladder's root, caused by an enlarged prostate gland, constipation, or pelvic surgery. Diuretics, taking diuretic medications while drinking plenty of water. As you become older, you are more likely to develop an overactive bladder. Urinary tract infection is another cause. Other factors include increased coffee and alcohol intake. Overactive bladder complications. An overactive bladder has a negative impact on one's quality of life, including social isolation, sadness, stress, and sleep difficulties. Diagnosis of overactive bladder. All possible causes of this illness must be ruled out in the early stage. To identify the potential of infections, diabetes, or other abnormalities in the action of the kidneys, a physical examination of the abdomen area, a nerve examination, and a urine examination are performed. The following are some diagnostic techniques. 1. Urination dynamics examination. This examination covers numerous parameters in order to examine the bladder's function and ability to empty. 2. Urine volume residual. The amount of urine left in the bladder after the patient has emptied it to the maximum capacity is measured in this examination, and the rest of the urine can be measured using a catheter inserted into the bladder or ultrasound, and when a large amount of urine remains after emptying, it may indicate an overactive bladder. 3. Pressure in the bladder is measured. Water is progressively pumped into the bladder during this examination to determine the volume of fluid in the bladder that creates increased pressure and the pressure that causes the person to feel the need to pass pee. 4. Examination of the bladder nerves. It is determined whether there is synchronization between the numerous nerves involved in the emptying process during this evaluation. 5. Endoscopy. During this procedure, a test tube with a camera on the tip is put into the bladder to examine inside and see if there are any obstructions. Treatment for hyperactive bladder. There are various therapy options, which are frequently combined. 1. Behavioral modifications. Behavioral adjustments alone may not be adequate to solve this health problem, but they can greatly reduce symptoms because they are tailored to the root cause of the disorder and include Drinking only a certain amount of fluids at specified times. Gradual constraint for longer length of time. Urinate once more within a few minutes. Using the restroom on a regular basis. Kegel exercises help to strengthen the pelvic floor muscles. Catheter emptying with assistance. Use absorbent papers to prevent enuresis-related confusion. 2. Pharmaceuticals. Medicines that relax the bladder are beneficial in lowering the need to empty, and there are several of them, including tolterodine is a tolterodine derivative. Oxybutynin. Trospium is a bacterium. These drugs are available in pill form or as skin patches that release the medicament over time. These drugs cause dry mouth and eyes as a side effect. 3. Stimulation of the sacral nerve. The sacral nerves transmit nerve signals from the bladder to the brain. The disorder's symptoms are limited by the effect on nerve expression. The electrode is inserted into the sacral nerve next to the tailbone, and the control box is hidden beneath the skin. Nerve signals are regulated by electrical stimulation, which lowers the urgent need to urinate. 4. Surgery. The surgical method is only used for more problematic patients that have failed to respond to conventional therapies, and involves surgery to expand the bladder using an intestinal coil. With the use of a catheter, a person can urinate following surgery,